Welcome to part 3 of our Summit series, exploring substance use and impacts during COVID-19. Introducing our host for today's session, Diana Vissers.
Hello and welcome. Thank you for joining us today. Our conversation today is part 3 of a 5-part virtual summit series designed to address and talk about some of the psychological impacts of COVID-19, specifically on the workplace. This conversation also, to accompany it, is a toolkit that we put together with the help of our guest today. Just a toolkit of some great information, resources, and tools to help every worker just understand and think a little bit more and examine issues about substance use and how they might impact them personally. I am so excited today to welcome our guest. If you have been following the series, you know that in part 1, we did talk a little bit about some of the statistics around substance use. And due to some of the stressors that we're all experiencing with COVID-19, substance use is increasing, and we have some pretty shocking statistics to share with you today. So Mike Mathers is joining me today for our conversation. We're in studio today, and again, a reassurance that we are being COVID safety conscious. We have a barrier between us. We're gonna high five. Thanks, we almost knocked it over. And so we are conducting ourselves safely, and we hope all of you at home are as well. So now, without further ado, I'd like to introduce Mike Mathers. So Mike has been working in the addiction substance use field for 15 years, working in various capacities. He is absolutely a treatment expert when it comes to substance use. He is super passionate about the topic, and I know you're going to be very interested in what Mike has to say in our conversation today. Mike, can you tell us a little bit more about you and why this topic is so important?
Yeah, thanks so much, Diana. Well, first of all, it is a real pleasure to be here because of how passionate I am about this. We have not had an addiction treatment system per se. That's been the problem. We've been failing people who have problems with substances in the last 50, 60 years for a variety of reasons. There's a lot of new ideas and research out there and programs, and this is starting to change. And I'm really passionate about being here because people just haven't had this access to this information and these options. And so having the opportunity to share about this, sometimes a little bit of information can make a really big difference in one person's life. And then all the people surrounding them benefit from that as well. So this is a real privilege to be able to share some of this information.
Yeah, that's so great. So I really like what you said about it's not just for individuals who may themselves be concerned about substance use of themselves, but that this information is really helpful to anybody who has someone in their life who, for whose substance use may be an issue. And even if you don't have somebody who's concerned about substance use, understanding kind of that what underpins our choices and our behaviors. And that's why I'm so excited to have our dialogue today. So we're hoping this conversation will really make that easier for people to think about on themselves. And given what's going on in the world with COVID-19, and we certainly have seen some really shocking statistics over the last number of months. There have been some interesting studies done by addiction research specialties. We know alcohol sales have gone up like 40%. I think I might have alluded in session 1. I've noticed my own use of alcohol, because I do use alcohol, has changed pretty significantly. And we have the highest overdose rate in BC that we've had yet. I saw an interview last evening. Dr. Bonnie Henry was talking about this, how COVID-19 has just introduced so many problems to the already broken system around access to care and even access to safe supply for those for overdose. So can you talk about what are those statistics mean to you? What does that suggest to you? What's important about that?
Sure. So I just want to say again, I've been doing this work for about 15 years. Started out working in the downtown east side. I've worked in a variety of capacities, residential treatment centers, private practice, psychological agencies. And, it's as bad as I've ever seen it right now. It was in terms of problematic substance use. Everyone knows about the opioid overdose epidemic crisis. It was bad before COVID. This issue was really bad before COVID. And so, you know, people are dying in record numbers, and it's really gotten worse since March as well. So what we're seeing now, what a lot of therapists and counselors are seeing now, and particularly what I'm seeing in my practice, is people are really at a breaking point in terms of their stress levels. And, you know, particularly the last 6 weeks, I think there's been about I've heard this idea of about a 6-month reserve on our emotional bank account, right? Not to talk about our actual bank accounts, but our emotional bank account. And so I've certainly seen in the last 6 weeks, 2 months, you know, the bad news is people are feeling a lot of despair, and there's a lot of suffering. The good news is, and this is the way I frame it, is that people are reaching out for help. And so there's 2 ways of looking at that. And so I'll just say, yeah, a lot of people are reaching out for help right now, just in terms of those numbers. Now, this is something in Alberta. I know I just want to mention this because it's sort of relevant, and I want to give some BC stats. Is that okay?
Yeah, please.
So in Alberta, a total of 301 deaths were recorded from April to June in terms of opioid overdoses, and that's more than 3 deaths per day. This was twice the rate from January to March.
Wow.
It's doubled, right?
Wow.
Now, what comes to mind in terms of occupational issue when we think about Alberta and COVID?
Yes.
Right? It's a very blue collar, a lot of people in construction in the oil industry, which has obviously been deeply impacted by these, you know, multi-layered problems. And we see the deaths of despair, is what they call it, have doubled in terms of opioid overdoses. Their government has also basically really dropped the ball and removed harm reduction services. That's another factor. I'm not even going to touch that right now.
Yeah.
But that's certainly a factor. In BC, from August 2020, we've already exceeded the number of opioid overdose deaths that had occurred in all of 2019. There's still 4 more months left. And each month we're nearly having record deaths. So there have been 1,068 illicit drug deaths in BC this year. And that's the August number, 147, 150 people who have lost their lives. And these are preventable deaths. I have to tell you, these are preventable deaths. This is not something that should be occurring. So 150 people, 150 families. And this represents a 70% increase over the number of deaths from August last year. And now, which was total of 86 in total. I mean, if there's any good news in this, August there was a 16% decrease compared to July. And it's not really good news because July was record breaking with 176 people that died as a result of opioid overdoses. BC Emergency Health Services reported close to 7,500 overdose calls throughout the summer. It's the highest number of overdose calls ever recorded in a 3-month span.
Wow.
And I could say more, but you know, on the reasons why this is happening, but there's a couple other stats, but I think this will come out a little bit. I just want to pause there. With those
lay the groundwork.
numbers.
Yeah, so lay the groundwork. I mean, and you know, it's when we hear statistics, I know for myself, sometimes I have to really think those numbers on by themselves sound quite shocking, but then really thinking about, as you said, every one of those statistics, at least half of those overdoses also are connected to a workplace. So we're also talking about what's the impact to the community in the work environment, particularly some work environments, some industries where they may be more represented. Like you talked about the oil industry and construction in Alberta. In BC, we also have certain industries that this might be really more impactful. And I'm sure we have listeners today who also have personal stories and experiences of people they know who have been impacted, if not immediately in those numbers, they're part of the bigger circle. So, I guess for myself, I always think about, what is driving that kind of behavior? Like, what is it What do you think is underpinning? You know, we talk so much about all the stress around COVID and how everything has changed and all the change. Why do you think people are using substances, you know, and not just the opioid crisis, but other substances too? Why are they using this despite even where it might bring harm to them? It might cause problems in their relationships and their health, with their family, all of these. Why do you think? And before you answer, I know you're primed to answer. I actually want to ask the audience this question. So we're going to do a poll right now. If you could look at your screens and please enter an answer to the poll on the screen. Why do people use substances to the point of harm in relationships, quality of life? And if you could just answer that question for us. We're seeing some come in. Really want to get a feeling for kind of what our assumptions, what our underlying assumptions are about, you know, what we naturally think is behind it. And let's just look at the polling. We're getting close to the end. Thank you for putting in your numbers. If you're watching this after the recording, we had a number of hundreds of participants here whose scores will be represented, and we're going to launch that poll result now, and we'll see. Very interesting in terms of why do people use, highest number, 62% of the participants are saying they think it's because alcohol and drugs are addictive. So 12%, it's a lack of willpower, 21%, it's a learned behavior, and only 5%, it's genetic. So Mike, with that framing, can you now answer the question for us?
Okay. Yeah, so that's a big one. And I mean, yeah, so we got to start. Okay, so basically what we're saying is, why are people doing something that seemingly is against their own best interests? Why do they repeatedly do something that is seemingly against their own best interests? Right? And so here's the thing. As human beings, we never intentionally do something that is against our own best interests. This is a long answer. I'll get to the point. Drugs and alcohol, this might sound controversial, but this is something I say to my clients right away and to the families of people with problematic substance use. Drugs and alcohol are not the problem. Drugs and alcohol are the solution. Now, they're not a good long-term solution. Let me be clear. For most people, they're not a good long-term solution. But they work in the short term to change how we're feeling, to change what we're thinking about, to deal with physical pain, right? Especially in the trades and construction and other industries where people are at risk of physical injuries. This is one of the things why opioids are such a big deal. People get injured on the job and then have physical pain, which is also terrible for our emotional well-being. So really, problematic substance use is an attempt to deal with emotional pain, sometimes with physical pain, but usually quite often with emotional pain. So addiction is not the problematic substance use or substance use is not the problem, it's the solution. It's the solution that starts to backfire in the long run. Right. And that's a really important piece to understanding this. Instead of, you know, assuming that people are bad or lack willpower or that drugs are bad or that alcohol is bad, we really want to ask, what's right about it? And I don't, again, mean in the long term, I mean ultimately in people's day-to-day behaviors as they make choices to engage in this behavior to try to solve this inner problem. What are they attempting to get out of it? What are they maybe it's relaxation, maybe it's coming home after a long day and needing to slow their mind down. Maybe they're physically exhausted and they're looking for some relief from that. Maybe with everything going on around COVID, there's stressors on the family system. Communication is breaking down and they're looking to just be able to take the edge off so they can better be there, you know, without reacting all the time. So I want to give a little bit, is it okay if I give a definition here?
Please,
and then kind of go in a little bit more into this. So we talk a lot about addiction. People talk a lot about addiction. That's a broad word that implies a lot of different things. I don't generally refer to addiction, sometimes in the shorthand. I like to talk about the behavior of problematic substance use, because addiction is a behavior. If we're talking about addiction, it's a behavior. It's not a label of a person. Labels are for jars. I don't refer to addicts. I don't refer to alcoholics. A person is not an addict. A person uses substances problematically. So addiction is a verb, not a noun, right? And this is when we're talking about why it's important to refer to problematic substance use. And language really matters. Stigma is a big problem. We'll probably get into this a little bit later. So one definition for problematic substance use could be ritualized, compulsive comfort seeking with negative consequences. Now, I know that's pretty long-winded. More simply, it's emotional regulation strategy. It's something we do to try to deal with our feelings. It leads to disconnection in our relationships. It leads to disconnecting from ourselves when it really becomes problematic. And it leads to a loss of meaning and purpose. And of course, a loss of meaning and purpose also leads to using substances to try to fill that void. So it's a two-way street there in how it develops. And often there's suppressed emotional pain and unprocessed trauma that's really at the root of this. Mm-hmm. So there's a lot more I could say here, but basically a problematic substance use is an emotional regulation strategy where people are trying to meet their basic needs. Not really a good strategy in the long term again, but that's what people are trying to achieve there. And it's a meaningful response to a lack of purpose. So dealing with stress, right? Many different kinds of stress. It really matters what kind of stress we're talking about. It's the stress in your conflict in a relationship, feeling strained in your parenting or distance from your children? Is the stress from feeling like worried about losing your job, or the stress of health concerns? But the stress of moving. Stress is a big word and implies a lot of different things, but globally put, it's an attempt to deal with, to regulate ourselves, to calm ourselves down when we're highly stressed. And it's also both drives disconnection in our relationships, and it's a response when we feel very isolated, and it comes from when we feel we've lost purpose and meaning in our lives, and it also leads to less purpose and meaning in our lives. Now let's look at that, what I just said. It's about emotions being heightened, it's about feeling isolated, and it's about a loss of meaning and purpose. Does this sound like what COVID has driven
This
home
sounds
for all of us?
exactly what COVID has driven. As you were talking, I was thinking, I was checking all the boxes in my mind about, you know, the distancing measures that were in place, the people working from different sites, some of the anxieties around getting sick, things that are happening in people's families. That all of this, like when you kind of set the table for substance use to be a response, it's not the problem, it's actually a response to a problem. In the context of COVID, this starts to make so much sense. And I can also see how that lens, that way of looking at substance use can help me understand substance use concerns that I might have about somebody in my life. That I can really see it as they're responding to what's going on in their life. And maybe that also gives a window to where some of the solutions might lie, on how we put pieces back together for people.
This is the first piece. If you're finding, you know, I'd encourage everyone, you know, for yourself or for those around you, to just check in and say, am I relying on these strategies around drugs and alcohol or behaviors, even gambling or, you know, I call it panic news watching on the internet that I was doing very early.
Yeah, or doom scrolling.
Netflix binging, overeating, these kinds of behaviors. Just get curious around these sort of maladaptive coping strategies to ask yourself, am I verging on doing any of these things problematically? And then don't stop there. The most important thing is to be really curious. What's going on underneath the surface? What need am I trying to meet? That is really key. That's how I work with people, is really figuring out what's the need underneath the behavior, because we need to figure out a different way to meet that need.
So it's so interesting. And so those of you watching may not know, but Mike and I have had a number of conversations in preparation for today he's been educating me around this topic as well. And Mike, I can tell you now that when we started having these conversations, and what I was hearing from Mike was a little bit different than what I had previously heard about substance use. And so I was checking in with myself, and he asked me once, what are the benefits to you? Like, right. What are the really good things about substance use? Because I was sharing with him that I was noticing I was consuming more alcohol than before, and kind of every day almost. And he asked me, what are the benefits? And I wanted to right away say, well, there's no benefits, because that's what we're supposed to think, that substance use is bad and that alcohol use is bad. But after talking with you and really looking through that lens, it really helps me understand now when I'm getting ready to pour myself a glass of wine, I'm thinking about, oh, why am I needing this right now? And is this the best way for me to actually meet that need? Or maybe there's something else that I can do if I'm concerned about my substance use. So just one example that I wanted to share. I also want to bring the conversation around to the workplace. So, I
just say one quick thing about what you just said before we go back there? Yeah. So that's so important. And again, if you're dealing with a loved one or you yourself and thinking about your thoughts on this, and you're trying to make a change in your behavior, or you want a loved one to make a change in your behavior, don't start with, here's what's everything that's wrong with what you're doing, right? Here's why you have to change. Start with, because if I had told you, oh, Diana, that's really bad that you're going and doing this and you need to stop, your mind will go, well, actually, here's the parts that are really good. And you're thinking about that, and this is the same principle on how I've gotten my children to eat broccoli. It's not rocket science. I bet you can't eat that. I bet you can't eat that in one bite. There's no way you're going to be, it doesn't really work anymore now that they're getting older, but they still eat broccoli. But this is how human beings are wired, children and adults included. We don't like being backed in the corner, told what to do, and told that what we're doing is wrong. Alternatively, when we're given options to explore problematic behavior on what we're intending to get out of it, our minds go to, well, actually, here's how it's negatively impacting me. And this is what human beings really have a desire to be autonomous. We want to be in charge. We don't like being backed into a corner. We want to be in charge of our behavior. So in talking to people about this, whether you're a supervisor or a manager or employer, and there's other issues that come up in terms of safety sensitive positions where it's a little bit complicated. There might be issues of trust and disclosures there, but in our personal relationships, certainly talking to people about getting them to understand what they're attempting to get out of a behavior, it doesn't reinforce it or make it more likely they're gonna do it. Actually, quite the opposite.
So you introduced the idea around workplaces and safety, and interesting because our framework for this whole series of conversations is about workplace. And when we talked initially about having a session and a topic about substance use, because the need is so obvious from the statistics we were seeing, we really had to sit back and think, why is substance use not normally a part of a conversation around occupational health and safety? And so typically where we do see the conversation come in is if somebody is showing up at work impaired, and there's some safety risks that are there. So oftentimes, by the time the workplace is engaged in even noticing or having dialogue or taking action, it's when there's a safety issue. Can you tell us, Mike, why do you think workplaces should be paying attention as well as in those situations? What does this have to do with the workplace anyway?
Yeah, well, there's a whole bunch of pieces here, and certainly around performance and productivity. When people have progressed along the spectrum of problematic substance use, their thinking, their judgment, their decisions, their ability to navigate conflict in relationships, right? And that's often a big piece of work, is how we navigate these issues where we don't always agree with people and how we communicate. And that's a big part of it, relationships amongst people. Of course, there's issues around withdrawal or people feeling really even ill if they've been using. There's safety risks if people are having problems with their attention. As importantly, there's a quality of life stuff outside of work. And so, we work with first responders together at Boreal Wellness, and we help people get back to work. The way I work with people, though, is I really want to improve their quality of life, period. Because I think when people are happy and well adjusted and have skills and strategies to deal better in their personal lives, they're going to be more productive and engaged when they show up at the workplace. And intervening, this is the piece I think around your question, is typically, for a variety of reasons, which we're probably going to get into, we've waited until small brush fires have become raging infernos in dealing with these problems. Or when people raise their hand and say, I'm concerned about my substance use, we give them the crew of firefighters, the smoke jumpers, to go in to deal with the tiny little brush fire, which might not be needed. So, there's a problem in two directions there. We want to be intervening earlier, which means we want to be catching this stuff earlier on so we can prevent brush fires from becoming raging infernos. We haven't done that. And we haven't given the right tools and approaches to people when they're dealing with less severe problems on part of the spectrum.
Right. So I'm hearing a couple of things. I'm hearing that as workplaces and as in our relationships in the workplace, it's really important to notice before a person, as you use the word raging inferno, but before the person is at end, to actually be having conversation and dialogue. I'm also hearing you mentioned a little bit sort of hinted at navigating treatment, because often employers, they don't have necessarily mechanisms in place and ways of helping people get supports. They might have some extended health benefits or an employee assistance program that could definitely help people start to address these issues. But if they're needing more specialized help, often employers get involved when there's a safety sensitive issue and someone has maybe, been impaired at work or something quite serious. You're saying, why don't you give them access to ways of sorting out the reasons and understanding what their substance use when they're in the earlier part of the spectrum.
Yes.
So this is a great time actually to show that image of the spectrum. So this is another image that is contained in the toolkit that we put together for you. And I just love this image for so many reasons. In every one of our sessions with the virtual summit series, we've used this image to just depict some really good information on understanding the range of issues, behaviors, risks, and for substance use. Mike, thank you. You've helped put this, very, very strong visual depiction. Can you explain a little bit about the differences across the spectrum, and then maybe speak to the bottom parts, which are about the kinds of treatment and remedies and help that we can get?
Quick time check just to moderate this answer here, because it's a big, long answer.
Just go ahead. This is important.
Okay. So first of all, to that, we need to be, we ideally as a society in workplaces, government organizations, down to the level of the family and the individual, it's important that we start being promoting wellness rather than being reactive to illness. That's a really key piece of this. Secondly, I do have to mention something in general around, addiction treatment and how we've kind of failed to develop a system. And I'm not here to bash 12-step programs. I don't do that. I think they offer tremendous value to people. I have seen it. My personal belief is they offer value in terms of the fact that they connect people with a healthy cohort, a healthy group of people, generally people that share their values, that can support them. That social reconnection. One of the things I see as addiction is an attachment disorder, meaning as human beings, we're hardwired to need other people. Relationships are really important to us. Think about it. A time if you've ever been really stressed out and someone you really care about has put a hand on your back, given you a hug, said an encouraging word, just been beside you. What happens? That's our nervous system regulating. It's called co-regulation. We are social animals. We don't generally exist isolated, right? So having said all that, Also, the 12-step approach, it's been a problem in terms of the fact that the addiction treatment field has not filled gaps in services for individuals, and this peer support program, as a result, has filled gaps that the medical system should have been filling with evidence-based treatment approaches. So again, not bashing the 12-step approach, there's been problems with it being applied into the medical system because we haven't had these evidence-based approaches that are preventative in place. Now, having said all that, what comes from the 12-step approach is a couple of things. This thing called the disease model of addiction, which basically approaches all problematic substance use as a disease, the idea that it's progressive and debilitating. If you don't, abstinence is the only solution, no matter really where you are with it. Medications, which are evidence-based and proven to be effective to help people with substance use disorders, are generally frowned upon. That increases risk, and it's seen in very black and white terms. And it's kind of infused our whole society's ways of thinking about it. A lot of people think the way you recover is going to 12-step meetings, going to churches, drinking cold coffee, sitting around talking to people, claiming you're an addict and you're powerless. And so that's led to a binary of you're either an addict or an alcoholic, or you're not. And it's just not true. There's a whole spectrum. And so this is where that spectrum is, and what we're talking about. But the spectrum ranges from, there's actually such a thing as the beneficial use of substances, right? I want to be clear, most people don't have a beneficial relationship with substances, but we make trade-offs in our lives all the time. It's pretty hard to have a beneficial relationship with donuts. Yeah. People eat donuts anyway because it brings pleasure, right? Yeah. We make these trade-offs all the time. So I just want to be clear, most people don't have a beneficial relationship with substance. Yet, what most people do have is the next part of the spectrum, which is a non-problematic relationship with substances. The pluses and minuses. Most people who drink, for instance, can take it or leave it, can drink socially, like go a long time without drinking, maybe have a couple drinks with friends, and then put it down. That's the majority of people. For various reasons, under stress, people that use non-problematically, though, converge into this other spectrum, which is problematic use. Right? And that's when we're going from basically the green to the yellow, and into the orange with some distress. And then there's the harmful use. So there's essentially this full spectrum, and people can move between different places, and different needs are required at different places. If we treat it as a one-size-fits-all, anyone who's using substance problematically has this disease of addiction, residential treatment, and lifelong abstinence is the cure, we're missing out on serving. This is the problem in the addiction treatment system, is we haven't effectively met the needs of people at the variety of these places on the spectrum. So, you know, even if you have a beneficial or non-problematic use, educating yourself, reading, these types of things. If you're starting to wonder if you're verging between non-problematic and problematic use, attending a support group, maybe seeing a therapist, doing some online tools, this sort of thing. If you're pretty clear you're using problematically or starting to verge on harmful use, attending a more intensive group, or if you're engaged on the red side of the spectrum and you're clearly sure that you are using problematically, this is where we see a severe substance use disorder. Clinically speaking, there's mild, moderate, or severe substance use disorders, and we want to have different interventions at different points on that spectrum. But if you're finding your way out there on the severe end of the spectrum, this is the people who it generally looks like the disease of addiction. These are the people that abstinence is usually what is required, intensive outpatient treatment again, or residential programs, going and staying at rehab, doing medically supervised detox, particularly with alcohol, and certain other substances where withdrawing can be actually really dangerous to your health. Alcohol is actually the most dangerous substance to detox from. Alcohol, if you're drinking and you're a severe alcohol use disorder, you want to see a doctor and get advice on how to do a medically supervised withdrawal. If people stop cold turkey, and this is the other thing about bad information being dangerous. Everyone telling an alcoholic who's drinking every day stop drinking could actually kill them. if they were to stop cold turkey. They want to do it in a medically supervised way and gradually wean off. So these interventions are going to be tailored towards where people are on the spectrum. And there's a key part there of, we also don't want to be wasting resources by sending people with mild problems to treatment centers that are costing either the individual, the organization, or public health $50,000, $60,000, $70,000, $80,000. That is an ineffective use of public resources as well. So I got on my soapbox there, but
that was so great, and it's actually very refreshing, Mike, to hear your language around some of the underpinning issues, underlying issues related to substance use, in the same way that we've talked about some of the other issues we've been addressing in this. So in our part one, we talked a lot about prevention and about how you as an individual keep yourself, push yourself towards the green. And there's a number of interventions, but definitely there's a role here for workplaces too. And so often workplaces have taken a role in substance use just at the point where there's a safety issue. And maybe it means, you know, they're intervening, they're doing some kind of intervention with the employee, and sometimes, and you know, often that means a residential treatment program if they're waiting right till the end. But there's so much opportunity for employers to be offering education, to be offering access to the kinds of learning and support options that you've included on the bottom of the spectrum graph way before a person is in that red. So knowing that COVID is generating all these other stressors, if somebody already is vulnerable to those stressors for whatever reason, maybe before they were operating, you know, they were running a line, they were running that line of coping. Now, the substance use may be more of an issue. So this is a great opportunity.
Absolutely. And just to add to that, remember, drugs and alcohol are not the problem. They're an attempted solution at a problem. They're the behavior that's at the tip of the iceberg. Underneath the iceberg, we have anxiety, we have depression, we have low self-worth, we have trauma, we have problems and stresses in our relationships, we have physical pain, we have financial stress. Again, does this sound like COVID?
Yeah, it sounds like COVID.
What I'm seeing and what I saw initially, and I think this will make sense to people, if you had no anxiety prior to COVID, you're now dealing with what's called mild anxiety. If you had mild, you're probably dealing with moderate. If you had high, well, my clients that are really anxious, clients with, they're kind of used to it. They didn't bump up. They were actually like, wow, now everyone kind of gets how I feel in my day-to-day, right? Which is very, very interesting. So I think it's really important to understand that we've all collectively gone up a couple notches in terms of these underlying things that tend to drive these maladaptive coping strategies.
So going back to the spectrum, and I think we're going to move on from the spectrum image now. Also just point everyone, there is the iceberg that Mike referred to as an image that's also in the downloadable toolkit that really is a very powerful image to help you look at substance use and you know, what might underpin some of the very strong addictive behaviors or problematic substance use behaviors, as Mike, you've taught me, you've schooled me in my language changes.
It's working.
It's working. So I thought now, like, let's talk a little bit about how do you know if you yourself or someone else is having, you know, needs to be concerned, needs to be checking in, if their use is problematic. And I wonder if we could just look at that next graphic. We have included some information which you provided, Mike, on what's the page?
5.
On page 5.
How do I know if I have a problem?
How do I know if I have a problem? So this kind of is like a bit of a checklist for people. So can you speak to this? Like, how do you know?
Well, here's the first thing. I mean, quite often, you know, other people quite often know that we're struggling more than we think we let on, which means that the people around us that care about us, that see us every day, they usually notice there's something wrong before we even do, right? So ask those that you really trust, you know, maybe not your boss, maybe not unless you have a really good trusting relationship with your boss, but like a loved one, a friend, someone who sees you consistently that you trust, like, hey, have you noticed anything different about my behavior? That could be a really good place to start, right? Other people are good reflections of our blind spots. But in terms of the other things you want to look at, can be just generally around the quality of life stuff. What's your quality of life like in terms of key areas, in terms of school, in terms of work? Are you taking risks in your behavior, right? And there's a whole variety of ways that humans engage in risky behaviors. There's more tension in your relationships, stress is a lot more fighting, angry outbursts and yelling and that sort of thing. These, again, it's just not just about the behavior of problematic substance use. It's in these other key areas that we want to look at to see where there's a problem. Of course, quantity of use, frequency of use, that's also indicative of the fact that there might be a problem, but it's these other areas that we've looked at. If you find yourself, there's more trips to, the liquor commission on your visa bill than usual, right? That might indicate that one's drinking more, or that tolerance is going up, and that you need to consume more to get the same effects that you used to do. So consuming more can be a sign of tolerance going up. Having intentions to want to cut back and not being able to do it, feeling guilty in the morning. Why did I do that? I told myself I wasn't going to go, to the dispensary or to the liquor store or to my dealer's house. And I did it. It was almost like I was on autopilot. That's a sign that things could be going around on giving up behaviors and cutting back on things. Now, COVID's has kind of another thing. It's forced the issue. My recreational basketball league, I can't do that. I couldn't do that anymore. Something that's really important for my wellness. I mean, if we're cutting back, so COVID's kind of cut us off from some of these healthy contexts that people use to stay well. So that can be a cause of the problem. And also, though, if you're withdrawing from these activities that are still available and spending more time pursuing your substance use or your drinking, that can be a sign. That's a really big sign that there can be a problem as well. And it can also drive people further into it as we get cut off.
So this is all great information. If you're watching this, this works kind of like a checklist. And then Mike has also included some screening tools that are really easy to do. In fact, when we were preparing for this, I actually took the screening tool myself. And I have to admit, when I started answering the questions on the screening tool, it's completely confidential. So no one actually knows that I filled it out. And the information you get back is quite informative, but I was feeling kind of a bit nervous when I was doing it, that I might actually have to change my behavior. And is it going to be okay? I have to be honest with it. Asks you some questions about how much you're consuming. And then I, submitted, and then it leads me to some information and also recommendations and suggestions about how to get help and how to maybe change some of the things that might be a little bit risky. So, so that's really useful for ourselves. And I want to maybe just check in now about, what if there is someone in our life who, you're watching this and you're thinking, wow, I'm really concerned about that person, or maybe I'm concerned about myself. When is the best time to help a person who is misusing or having some problematic use? And again, before you answer, I wound you up for the answer.
No, I knew that was coming this time.
I want to ask the participants, if you could answer this poll for us, when do you think is the best time to help a person who's misusing substances? And the poll is going to come up across the screen. And if you could just quickly respond your answer there. There's a few options there. Thank you. Some of you have started to respond. So the first one, when the person is into serious trouble. The second one, when they hit rock bottom. And the third one, when they ask for help. So we're seeing some come in. I think we might be very interested to hear the results. So I'm very interested to hear from you, Mike. what your thoughts are. We're almost done the poll, and we'll reveal that first. We'll do the big reveal before we move further.
Yes.
Okay, so we have a winner for the top answer. So we're going to launch those results right now and share them. So 75% of the people participating today are saying it's when someone asks for help. 20% are saying it's when they get into serious trouble. And 5% are saying when they hit rock bottom. So can you respond to this, and also, when is the best time, and how do you actually go about that process we'll talk about next?
Right. Okay, so yeah, I mean, clearly when people are motivated, engaged, and willing, that's the most time when I think we have to parse this question. When people are leaning forward and asking for help, that's the time when help is likely to be most effectively received. That's true. Absolutely. It doesn't mean it's the only time we can offer it. So now I think we do have to kind of back up a step. And this idea of rock bottom, everybody's heard of this. This is not everyone had espoused that was the best time to hit, but everyone's heard of this notion. Yeah. And I think in some ways this idea does pervade a lot of thinking, that somehow negative consequences, extreme negative consequences, will be helpful or sufficient or superior in motivating people to change their behavior. So one of the ways, and there's so many ways of defining addiction or problematic substance use, but it's essentially, there's changes that go on in people's neurobiology in their brains that make it less likely that they're going to learn from negative consequences. AKA, addiction makes it so that people have trouble learning from the mistake. That's why people keep doing it. It actually impacts our abilities. So this, again, we go back to rock bottom. We're saying, and this has been the whole problem of, it's why we changed from prohibiting alcohol to making it legal. It's not because alcohol is healthy or good for us. It's because banning it made it a lot worse. Same thing with illicit substances, with our current approach and our drug laws. This idea that criminal justice system is the most effective way of changing people's behavior, punishing them, shaming them, isolating them, cutting them off from healthy supports and contexts, and that's somehow going to make them change. Really, really bad idea. And in the future, this is going to change, and we're going to have a much different approach. We're still digging our way out of that. So this notion of rock bottom, that somehow we have to wait until people have really, really hit the wall, and then that's the best time to offer support, and not before then, that's a really, really bad idea. So basically, yes, we're most likely to have success at people accessing these services when they are willing, engaged, and asking for help. We don't want to wait. If we're noticing issues in our loved ones, we don't want to wait. And so what can you do if the person's not willing to have the conversation? Right? That's a big problem. What if every time you bring up their drinking, they're blowing up and it's a 3-day, battle? People stop asking, right? And that's kind of what the behavior is trying to do. So what can you do then? People, there's an approach called CRAFT, Community Reinforcement and Family Training. And this is an approach that I use with families, loved ones, friends of people with substance use disorders. It's another piece. People have probably heard about Al-Anon, and this is the 12-step version of the approach for families. And again, this is not to bash that approach, but with Al-Anon, the idea is you got to let them hit rock bottom, detached with love, tough love. All these ideas pervade the treatment field, and families and loved ones have been given these ideas, and quite frankly, there's not a lot of love in tough love, right? That's not love. So we have this approach called CRAFT, which is different. And if your loved one is not willing to do anything about it, you can do something about your reaction to their unwillingness to do something about it. You can learn how to better communicate with someone who's using substances problematically. They don't even have to know you're doing it. There's a book called Beyond Addiction, and I really encourage, if you're dealing with a family or friend or loved one who's not willing to engage in treatment or even have the conversation, go and get that book right now, please. Beyond Addiction. I think it's in the links included.
Yeah.
And CRAFT, do some research on CRAFT, and the research shows, again, so let's take a person with a problematic substance use disorder, not willing to do anything. The loved ones, the family, goes and does 6 to 8 sessions of this CRAFT program, which teaches skills on how to communicate better and more effectively take care of yourself. 67% in this study of the people with the substance use disorders decided to get into treatment without any intervention, encouraging them to do something about it.
Wow.
The families and the loved ones learned what to say, what not to say, when to push, when to back off. It's not rocket science. When you give people these tools and skills, again, it's 2/3 of the people with the substance use disorders decided to get into treatment where they were previously unwilling. With Al-Anon, it was 1/3. So it's twice as effective to learn to use the levers in the relationship that we do have, rather than just to back off and let people hit the wall. And with this opioid overdose epidemic, you know, and the poison drug supply that we're seeing as a result of our current drug laws, that's essentially what this is. There's no reason for these deaths to be happening. What's the ultimate rock bottom? Death, right?
Yeah.
Who's willing to allow that to happen to a loved one? So it's not to say we want loved ones to take responsibility or ownership over people's problems, but getting some coaching advice on what to do, what not to do, can be a really effective way of preserving your own sanity, your own quality of life, and encouraging the chances that the person's gonna want to get help.
So this is all so interesting, Mike, and the resources that you've talked about today and that are included in the toolkit. You know, they are there, they're free. Spread them widely, give them to everyone, hand them out at your workplace. Do something with the content so we can really start changing the way people are approaching substance use and finding access to treatment. So we have just a couple of minutes left. So I thought maybe now would be just a really good time to point out some of the other tools that you've included, Mike, in the toolkit, and then we might have questions for time for a couple of questions or comments in the chat box. If you put a question in already, or if you have one now that you'd like to ask Mike, he's here for a few more minutes. So I just want to highlight a few things that you included in the toolkit. So in addition to what we talked about today, so far, you also include some great information for guidelines for families or for somebody who is concerned about someone else, how to have a conversation, the do's and don'ts around discussing with others, and some awesome links on that resource page to further resources. So you can learn a little more about the CRAFT approach. You can also find a CRAFT certified practitioner if you're interested in somebody yourself or somebody else speaking with a counselor and starting to examine your own substance use or someone else's. So are there any questions for Mike at the moment? So we'll just wonder if we could maybe take a moment then and take a look at the do's and don'ts. And if you could just go over the do's and don'ts a little bit for the audience at home. We have about 2 minutes.
Okay. So again, I think this is the broccoli issue, right? Mm-hmm. Don't start with hammering people over the head with all the negative things and why they need to change. That's going to lead to shutdown. I'm going to just speak off the cuff here, and because I think those suggestions are pretty pragmatic and straightforward. And so don't start with that. Start with the conversation about your concerns, about what's underneath the iceberg. Hey, I noticed you don't have that same twinkle in your eye. You're not, I'm concerned, right? Your mood seems a little bit lower, rather than starting, hey, you're drinking too much. I notice you're tempered. You don't seem to be enjoying time with the children as much, and that concerns me. What can I do to help? Start with those types of problems before getting into the real concern, right?
Mm-hmm.
My motto in parenting is connection before correction. And adults are just big kids. We're not really that different. People want to be heard and understood. Start with connection before, getting into problematic use. The other piece is look at red light, yellow light, green lights. We want to pick times to have difficult conversations when there's a green light, meaning, another way of saying this, strike when the iron is cold. Don't have a conversation with someone about their drinking when they're knee deep in it.
Yeah.
That's the worst time to have it, or in the middle of a fight, to bring that up. And it doesn't mean you can't have those conversations, but if there's a red light, back off, wait till there's a green light, and use the red light, green light on terms of people's receptiveness on when to engage in these conversations. You're going to have the most likelihood of having an effective conversation if you read the signs. Right. And there's a little bit of an art to it. So.
Okay, so we have a question.
Yeah, so we have a question come in here. We have somebody asking if there's a questionnaire for asking employees, as there's lots of different confidentiality issues around substance use and misuse.
So if there's a questionnaire?
A questionnaire for asking employees, or I guess an appropriate way to ask employees about their...
So maybe I'll just take that one, being in the occupational health and safety realm. So excellent question. So as an organization, as an employer, how do you actually broach the topic of substance use with your employees? Because there's privacy issues, even if it's a health issue, there's privacy issues, and there's, people may not want to talk about their substance use, and it may not actually be the best place to talk about it. From my perspective, the best thing an employer can do is put as much information and options and get resources in front of people. If you're noticing, for example, there's a work culture issue around substance use, maybe, we know there's some industries that, drinking together after work or even at lunchtime is a usual part of it. If that's a problem, which in many cases it probably is a problem, then addressing it head on and being really clear on what your policies and procedures are around that. Put them in writing. And address the issues that do fall on the problematic side, but also give people access not just to the treatment that happens in the red category at the very end when someone is coming to work and is impaired and there's concern, but also give them access to looking at examining their substance use issues in a different way, looking at the issues and the problems that underpin substance use, as Mike was talking about. So very good question. Having conversation about substance use in the workplace is a bit tricky. And Mike mentioned a couple times in our dialogue about, if you have a good relationship with your employer, ideally, if a person is on the far end of the spectrum, that can qualify as a health issue, and you can hope for some support from the employer in that regard and getting connected to the right resources. But I also think that just having healthy conversation in the workplace, like showing this conversation in a work setting or making it available, circulating the toolkit, and as an organization saying we care about people. We care about the people who work here. We want you to have access to the resources. Mike, I know as always, you and I could be talking about this for a lot longer than the hour we were given today.
I do just want to add one more thing to that.
Yeah.
Send them to us at Boreal Wellness, maybe as well. And I have to just say this here because I'm really passionate about this, but we've started virtual online outpatient treatment for people with mild to moderate substance use disorders. And if anyone's looking for more information about that, this is going to be a really effective way to focus on both those, giving people tools to regulate themselves, to connect with others, and to develop meaning and purpose and improve their quality of life. And we've created this program to offer this part of the spectrum that is not really being served for about the cost of a day and a half of residential treatment. And we focus on these underlying issues to help people improve their quality of life so that they can reduce their substance use problems and be more effective in the workplace. So I'd be happy to talk to anyone who wants more information about how we do that.
Fantastic. So we are
Thanks for
going
letting me get that in
to,
there.
yeah, we're going to post Mike's contact information, and you can certainly find him. There's a link to his connection on the resource page. Mike, you have really changed my lens looking at my own substance use, but also other people in my world, and even through the work organizations that I have access to. Thank you so much for coming today. Those of you who are watching this later, I hope you also connect with some of the other sessions we've had. As I said at the beginning, this is session 3 of a 5-part series. Our next part 4 will be talking to managers and supervisors in how to lead effectively their teams during this interesting time of COVID. Substance use, hopefully we'll tell them to, they'll watch this conversation as well, but we're also going to be dealing through that conversation a little bit about what the remote work environment has done in disconnection, as Mike talked to as well. So we will be taking the conversation offline. Join us in the discussion forum, and I look forward to seeing all of you again in 2 weeks when I'm joined by Carmen Bellows, who's a psychologist practicing with Sun Life, working in their work health division, supporting managers and leaders and teaching them how to be effective. So I look forward to that. Thanks again, Mike, and everyone have a safe day.